I've had the privilege to go out and provide the vaccines. And a lot of these questions that we have asked are the questions of the community, are questions that are real for every individual that is out in the community. And we want to make sure that everyone understands that the vaccine is safe, that if you have any questions, I highly encourage you to reach out to your provider to be able to address any concerns that you might have so that you can make a better choice to why you should vaccinate your child. We are here, we're looking at actually for our patients, we are going to be vaccinating.
We do know that children can become infected with the SARS-CoV-19 virus. To date, there have been more than 6 million children who've actually gotten sick with COVID. And we've seen actually as close to 700 children die from COVID complications. I'd just like to turn it over to our pediatrician here, Jill.
So COVID itself, as Dr. Harp said, is very contagious if you are near someone that has the COVID vaccine. And when someone is infected with COVID, some people don't have any symptoms, and so you don't even know that they have COVID, and they may be passing it to someone. And it's much easier if it's somebody that's unvaccinated. And that's what we've been seeing with the Delta variant, that we've been seeing a lot more children with COVID illness due to the Delta variant, and those children more often wind up in the hospital. So we're recommending vaccination to help prevent COVID illness. And we are very happy to say that from the children from 5 to 11 are okay to get vaccinated now by this FDA and also the CDC. And if a child gets vaccinated, if they get exposed to COVID, they're much less likely to get seriously ill and wind up in the hospital. That's true for adults also. So that's one of the main reasons that we want children to get vaccinated. We also look forward to them having many children being vaccinated, so this way, if enough children get vaccinated, they might be able to take away the mask mandate in school. And this is the school age, this is elementary school aged children now.
So this vaccine is considered very safe and effective, the Pfizer vaccine, which was just approved by both the FDA and the CDC, as Jill mentioned, for emergency use authorization for children between the ages of 5 and 11. Side effects are rare. Most of the time after injection, there may be a little bit of pain in the arm sometimes. In addition to soreness, there may be some redness. But the side effects are generally very mild.
There's concerns in the community that the vaccine has been developed very rapidly. And so how about the effectiveness and how that can actually hurt a child in their development or moving forward in years to come? So what can you say about that?
So I'd like to address this in two parts. One is that although this is a relatively recent infection, coronaviruses by themselves are not recent. They are well known, so that many of the scientists have been studying coronaviruses, and also the technology for the messenger mRNA vaccines. Although this is a novel application, that biotechnology is also not new. And so fortunately, we've been able to merge and intersect our knowledge of both the coronaviruses and this application of a biomedical technology in order to address this need rather rapidly.
I think the COVID vaccine is very effective. I was able to start seeing patients again because I got the vaccine, and it made a huge difference. And this way, families can get back together again because they're not afraid that they're going to pass COVID to each other. And that's a beautiful thing. And as I said before, children should be playing together, and they're able to do that. Children can not have many symptoms and not be very sick at the time of COVID, but later on they can develop symptoms and have an inflammatory syndrome and wind up being very sick after that. So that's another reason to vaccinate children, to prevent them from coming down with some chronic illness and having some very serious complications.
So we will be running a series of vaccine clinics for our patients and for all children. Please consult our website or our Facebook page.
And the information about vaccines will be in Spanish also for those of our families that speak Spanish.
Yo le quiero exhortar a la comunidad hispana que consideren vacunar a sus niños. Los va a mantener seguros, le va a dar la oportunidad de poder regresar a tener ese sentido de normalidad que queremos. Hay una posibilidad de que el gobernador declare que los niños que estén en la escuela no tengan que utilizar las mascarillas. Para más información vamos a tener vacunas para nuestros pacientes y adicional a eso para nuestros pacientes para personas en la comunidad. Por favor, visiten nuestra página de web y adicional a eso a nuestras otras redes sociales para más información para las clínicas que vamos a tener disponibles. Gracias.
Please consider getting your children vaccinated.